If you have melatonin in your house, listen up. Health officials are sounding the alarm after 2 children died from taking too much. Melatonin is a dietary supplement that can help people fall asleep, and more folks have turned to it during the pandemic. But according to a study by the CDC, the number of reported melatonin poisonings in kids has increased by 530% in the last 10 years, and less than 6% of those cases were intentional. Dr. Karima Lilak is a pediatric emergency physician at Children's Hospital of Michigan. She's also the lead author in this latest study. Dr. Lilak, thank you so much for joining us. Tell us what your research revealed about melatonin and the risk for kids.
Of course. Thank you for having me. The biggest takeaway from our research was that over the course of 10 years, and so from 2012 to 2021, pediatric ingestions of melatonin increased by about 530%. And that was really the take-home point, because what we really wanted to study was trends. And so with that, the biggest thing for us to take away from it as parents, as caregivers, or anybody with children at home, is that we should, be putting melatonin away in medicine cabinets and lock boxes, wherever you would keep your other prescription medications, and not necessarily, on your nightstand or on a coffee table where it might be sitting.
Well, and the other concern, and correct me if I'm wrong, but many of these supplements, melatonin, for example, comes in gummy form, so it looks like candy.
Yes, that is very true. It does come in a gummy form. We did not necessarily study different forms, however. We didn't look at, whether one form was more commonly ingested than other forms. But simply having a child, of course, they would probably be, they might be more interested in something that is gummy form. But regardless, children are still, at risk of taking something in liquid form, in tablet form. So regardless of what form it comes in, we should still be cognizant of putting it away and putting it out of reach of children.
How is a melatonin overdose treated if it were to happen?
So really, when somebody takes too much melatonin or more than they intended, the symptoms can vary. They're very non-specific. So you can have things like nausea, vomiting, you can have things like drowsiness, and so you really treat based on the symptoms.
Melatonin, as you know, doctor, is a hormone. It helps control the body's sleep cycle. It's not regulated by the FDA as many medications are because it's a supplement. Should it be, with such a rising rate in poisonings?
That's difficult to say, right? Because, in our study, we found that most children actually had no symptoms, and most children did very well. Most children did not end up in the hospital. Most children did not have any symptoms at all and had no sequelae, after they had taken more melatonin than what was intended. It was a very small subset of children that had symptoms, and an even smaller subset of children that did have to go to the hospital. So largely, melatonin is safe. It is safe to take, and it's safe to still use. It should, just be put away, just as any other medications, because children are at risk of grabbing it and getting a hold of it without us even knowing it.
Yeah. Important advice tonight, Dr. Karima Lilak. We appreciate you coming on. Thank you.
Of course. Thanks for having me.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.